Good evening, and thank you for joining us for WSLS 10 at 6. Now, the nationwide heroin epidemic continues to affect families right here in Southwest Virginia.
As we've reported, our region has seen a staggering number of overdoses and deaths related to the drug. Tonight, a heroin summit is bringing overdose to the forefront of the conversation.
WSLS 10's Bree Jackson joins us. She's live in Roanoke tonight with more on this. So, Bree, we know that overdoses are on the rise. We reported on that, but this problem could be worse than the numbers are actually showing.
Absolutely, John, and local leaders are trying to get a handle on how big the problem really is. I talk with officials here at the Roanoke City Fire Department, and they tell me that the numbers have nearly doubled over the past year, and even with those higher figures, the issue is probably bigger than those numbers appear.
Heroin is pouring across the border, and it's going all over the country, by the way.
During his visit to Roanoke, Republican presidential nominee Donald Trump talked about heroin's devastating impact on states like New Hampshire. That message hit close to home for Virginians. Roanoke City is among the places seeing a rise in drug overdoses and deaths.
We are seeing that people are losing their lives. I mean, 2 weeks ago, we had a 35-year-old that overdosed on heroin and passed away.
Compared to this time last year, Chief Hoback says the number of suspected heroin cases has more than doubled from 40 to 88. He says that's a rough estimate based on the environment in which patients were found.
Maybe the patient is not telling us that they have used heroin, but we see the drug paraphernalia around, and they're exhibiting signs and symptoms of heroin overdose or heroin use.
Hospitals reported an increase in heroin-related cases, too. The state health department says in Southwest Virginia, ER visits jumped from 29 in 2015 to 38 visits during the same time period this year. It's a widespread problem affecting all parts of our community, and emergency workers say they're only seeing the surface of the issue.
But their heroin use goes on all the time, and we never get called, but it impacts their ability to pay bills, it impacts their families, impacts, the crime rate and everything else, so it's huge.
And while fire and EMS are prepared for any situation, many say it will take a unified effort to tackle the heroin problem.
We can try, but it's really going to be up to them, it's got to be up to the family members to get them into the help they need, the counseling they need to kind of turn their lives around. And not only turn their lives around, they got to stay turned around.
And that's the point of tonight's community conversation. School leaders and other local officials are taking part in it, and that event is happening at 7 p.m. at the Virginia Tech Carilion School of Medicine and Research Institute here in Roanoke. In Roanoke, Bree Jackson, WSLS 10.